Assalamu alaikum. I think we'll start the program. So, Assalamu alaikum, everyone. Thank you for coming along today and giving us your precious Saturday. First of all, many thanks to Allah subhanahu wa ta'ala for giving us hidayah to come here. I've got a range of specialists, paramedic, junior doctors, and heaps of volunteers here who have come to actually make this program a success. So the way it's going to run today is we will start the program in about 5 minutes. We have got the dua, and then we will get our New South Wales president, IMA president, to have a few words, and then we'll get the program started with a demonstration, a presentation, and then a breakout for the practice. First, kids, so any child who's less than 12 can stay here. We have got facilities up on the first floor for kids with activities, and also there's a mannequin or a model that the kids can try their hand on. Housekeeping rules, number one, so in terms of exit, so if there's any emergency, the front door is our way to exit, and the assembly point is next to the stairs. In terms of toilets, the toilets for the gents are in the base from the left side, and for the ladies, it's on the right side if you're facing them. Right, okay. So can I start the program with the dua by Dr. Shakib here? Shakib, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وهديناه النجدين فلاقتحم العقبة وما أدراك ما العقبة فك رقبة أو إطعام في يوم ذي مسغبة يتيما ذا مقربة أو مسكينا ذا متربة ثم كان من الذين آمنوا وتواصوا بالصبر وتواصوا بالمرحمة أولئك أصحاب الميمنة صدق الله العظيم. The moral of these verses are, for humankind, there is only two paths to travel. Most of the people travel through the easy path, which is not a path for success. But the path for success is difficult one and hard one, and that is to serve for humanity, to help people in need, difficulties, and hardship, to help people from freeing their slavery, help people, those who are orphaned, oppressed, in need for hunger and thirst. And the path of success is to travel through these difficult paths and help each other with patience, compassion, and mercy, with the true belief in Allah subhanahu wa ta'ala. And those who pursue this path are ultimate successful people. So Australian Islamic Medical Association wanted to travel through this difficult path, and we choose to travel through this difficult path. This is why we are here. Try to help our brothers and sisters and our community. And we want all of you us to extend your hands to join with us and help for the humanity. Assalamu alaikum.
Jazakallah khair. So with such inspiring words, let me introduce you to New South Wales President of IMA, Dr. Al-Abbas. Where are you? Please have a few words for us. Thank you.
بسم الله الرحمن الرحيم الحمد لله وحده والصلاة والسلام على من لا نبي بعده. My name is Al-Hassan Al-Abbas. I'm a specialist general physician and geriatrician at Liverpool Hospital. And I'm currently the president of IMA, IMA New South Wales, Australian Islamic Medical Association. For those who don't know, our first time here of IMA, IMA is an organization for Muslim healthcare professionals, doctors, dentals, allied health, paramedics, and actually it's Australia-wide. So we have a central body and we have a state base. So I'm the president for the state, and we have a leadership team. First, I welcome all the brothers and sisters who are responding to our campaign program and registered to come for this training today. but also I will try to extend my appreciation and thanks to our coordinator, Sister Saadia Ghulam. She is working tirelessly, and without her dedication, this program wouldn't see this success. This is our third year. We run this program every year. In between, we do it, I think we did it in multiple masajid. I think this first time we did it here in Masjid Al-Imam Ali. This program, I think, it ran back from, it started in UK. BIMA is a British Muslim Association, and now actually most of the Islamic medical association in Muslim country, they do this program in the last Saturday in each September. But we do it in between. Also, can I thank our collaborators, St. John's Ambulance, and I think we have also sister from New South Wales paramedics. And I think for those brothers and sisters you come to train here, we really also appreciate our volunteers. We have cardiologists from all subspecialty to the junior doctors. So we have cardiologists, ophthalmologists, we have here general practitioners, we have junior doctors, all kind of specialty. We have allied health paramedics and even medical students. We really appreciate their time, and some of them entirely family. I think Ghulam Destiny, brother, Ghulam and his whole family, they are health professionals here. We really appreciate it. So they dedicated this time to teach and train our community. It's very important. Nabi Sallallahu Alaihi Wasallam said, "Atlub al-ilm min al-mahdi ila al-lahd." Seek knowledge from the cradle to the grave. And I think this is important knowledge. Each one of us will need it. And I think especially for sisters who have young children, learn the skill, especially that choking, because it's very common. And rather than in a panic, this is a very controlled environment. Each our trainee and volunteer here are a Muslim and dedicated Muslim. And we know that about the sensitivity about our sisters, a Muslim with the hijab. We really here, we're all Muslim. And if you feel uncomfortable, let us know. We're gonna cater for that. But the most important here, we want to teach you those skills that we're doing on a daily basis to our Muslim sisters and brothers in our Muslim community, to learn those basic skills, so in case of emergency, they will be the first hand to save their family members, their community members. And at the same time is a skill, even if there is a foreigners. If you save a life of any mankind, as if you save the whole humanity. And I think our deen is we do the khair, the goodness, not just for us as a Muslim, actually even for animal. So Islam is a mercy. Prophet Muhammad sallallahu alaihi wasallam being saint, rahmatul lil alamin, وما أرسلناك إلا رحمة للعالمين. Our Prophet is a mercy for mankind. And that mercy cannot just be word, could be with actions. And there is no more mercy than saving someone's life or giving hand in critical between life and death. I don't want to take from your time and to take from that valuable time of training. Try to take the best, enjoy it, with all our volunteers, some of them in their scrap, fully professional. We here, this is for you sisters and brothers today. Ask us any question, take the much advantage from this program, and inshallah we will continue. And I thank again our volunteer. Without you, without your dedication, we wouldn't be able to run this program. And alhamdulillah Rabbil Alameen. Jazakumullahu khairan.
Thank you so much. Now, can I invite Dr. Shahab Pathan? He's a cardiologist, a senior cardiologist who is among the Musallis. You wouldn't know him unless he comes here. Welcome, and please. There you go.
Assalamu alaikum, everyone. Thank you so much for being here on your Saturday and for giving up your time. We can't do this without you guys attending, so we really appreciate it. If it is possible, I'd like you all to maybe turn your gaze toward the left. I know you're seated this way, but that would be great, just so we can all be on the same page. So we're going to go through, obviously a big premise of why we're here, which has already been mentioned, is that we all have the power to potentially save someone. And if we save one person, it's as if we have saved all of mankind. Now, just a disclaimer, this is not an official course, so it does not replace official basic life support or a CPR course, but we're here in the spirit of learning. So very briefly, and I think Brother Al-Hassan spoke about this quite well, so we are IMA, so we're the Australian Islamic Medical Association, but we're part of a broader, bigger organization called FEMA, which is the Federation of Islamic Medical Associations. And what we want to do is to bring our Muslim community together to help empower everyone so that we can serve the broader community, Muslims and non-Muslims alike. So a bit of an introduction. I want you to imagine something. Imagine you saw this, perhaps outside, or maybe you see this at home, to your friend, to your loved one. What if you saw something like this? You saw multiple people, lifeless, non-responsive. Or perhaps you see something like this. I know that this has happened to me 3 times growing up. And it may have happened to other people, or perhaps maybe our children and friends. These are all very scary and very confronting situations. Would you know what to do to save their life? And if you don't, that's fantastic. That's what we're here for today. And we'll all learn together. Okay. And inshallah, in the next hour, we'll all come out with some very empowering skills. So I'm going to skip this slide just in the interest of time, but ultimately our vision as an organization is to unite, to inspire, and serve our community. This is a brief video that we will play for you.
Australia's story is one of migration, resilience, and diversity. And from the very beginning, Muslims were part of it. Their story didn't begin yesterday. It dates back to the 16th century. Makassan traders, Afghan cameleers, pearl divers, farmers. Muslims traded peacefully with indigenous Australians, building bonds of harmony and legacy. Today, that spirit lives on through the hands and hearts of Muslim healthcare workers across the nation. The Australian Islamic Medical Association, AIMA, a movement of doctors, nurses, and allied health professionals united to serve, lead, and uplift.
IMA's main focus is our youngsters. You are our future, and we want to invest on you. Any connection, any participation with IMA will keep reminding you. You have a life which should have a higher purpose.
From national blood drives to global medical camps, from battling COVID-19 to saving lives in our mosques, AIMA stands on the front lines of care, compassion, and change. In a time of growing division, AIMA stands tall, showing the real face of Islam: peace, generosity, and healing. If you're a Muslim health professional, your voice, your heart, your hands are needed. Individually, we are drops. Together, we are an ocean. Australian Islamic Medical Association, serving with care, leading with compassion.
The other, as I mentioned, we are part of something bigger. We all are part of something bigger. And this vision that we have, this has been extending all around the world, all the way from New Zealand to Zimbabwe and everything in between. Okay, so the question comes, why should I learn basic life support? Does it matter? Is it something that I will ever need to learn? And the answer to that is yes. I'm going to talk very briefly about why we're learning this. And I'm going to touch upon the idea of something called a cardiac arrest, which we may have heard of before. So a cardiac arrest is caused when the heart's electrical system malfunctions. In cardiac arrest, death results when the heart suddenly stops working. Now, the most common cause in the community of why cardiac arrest occurs is because of a heart attack. It's when the heart gets a sudden and a massive stoppage to its normal blood flow, which causes the heart to go into a dangerous heart rhythm, and ultimately the patient can die. It's staggering to know that about 70 people a day in Australia, every day, will experience a cardiac arrest, and the vast majority of these individuals will die. However, CPR, which is performed by bystanders or members of the community or at someone at home, can double or triple the chances of a patient's survival. So it makes a big difference. The statistics are also quite confronting. So in Australia, if you have a cardiac arrest, your chances of survival are 10%. If you live in other parts of the world, they can go up, but they can also go down significantly. And a big reason why this can also is influenced by is a lack of effective bystander CPR. In Australia, depending on where you live, on average, it takes the ambulance about 9 to 15 minutes to respond to a cardiac arrest. We're quite lucky, to be honest with you. In other parts of the world, it is completely different and it's much longer. Every minute that you don't either get effective CPR or you don't receive a shock from a defibrillator machine, which is something that we will all practice today as well, your chances of surviving drop down by 10% every 60 seconds. So just a few things, we all think about, well, this is not going to happen to me. Well, as I mentioned, about 70 people a day, 30,000 Australians a year suffer a cardiac arrest. 2 out of 3 of these individuals are going to be men. This is all the more reason why it's fantastic there are so many sisters in the room, because unfortunately you might actually be the ones who will need to perform CPR on your loved ones. So we have to keep that in mind. Roughly 80% of cardiac arrests occur at home. They rarely occur at the hospital, they happen at home. And it can affect all age groups. Early CPR makes a big difference. And one final point is we're going to talk about a few general tips to keep in mind in terms of living a healthier lifestyle and things that might help to reduce our chances of suffering from something that is so catastrophic. Keep things simple. You don't need to know specifics. It's about following common sense principles. Eat healthy. Try to eat less takeout, less processed foods. Keep in mind the sunnah. Don't overeat, so maybe keep a third of your stomach space for food, a third for water, and a third for air. Exercise regularly. Any kind of exercise helps and is important, even if it's just gentle walking. Like I said, do not complicate things. Keep it really simple. Sleep well. And also, please do not ignore the warning signs. Unfortunately, many people we see in the community leave things to too late when something catastrophic happens. If you are getting chest pain, if you're getting short of breath, you do not feel well, seek help and do not leave it till too late. And to kind of reinforce this message, I'm going to ask Brother Rashid, who's an emergency physician, to give us a story which is actually very close to home. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, subhanallah, walhamdulillah, wa la ilaha illallah, wallahu akbar. La hawla wa la quwwata illa billah. Salatu wassalamu ala Sayyidina Muhammad sallallahu alayhi wa sallam. It's a weekday morning. You are witnessing something that happened in Coogee, near the swimming pool, earlier this year. It's a beautiful, normal day. Everybody's doing what they normally do. Birds are flying, chirping in the air by the grace of Allah subhanahu wa ta'ala. People in the swimming pool, the LifeSavers, are cleaning the instruments and doing what they normally do. Nothing out of the ordinary. Some people are doing council work. One of them is George. George is reversing his truck to a pavement to park. And his best friend, John, is guiding him. They work together. And John notices that there's something wrong with the way he's reversing this truck. And he looks up and he sees that George is slumped onto the steering wheel. So he immediately realizes there's something wrong, opens the door, and notices that George is unconscious. So he tells his friend, "Get help." Fortunately, not far are the LifeSavers from the swimming pool, which is Coogee swimming pool. they suddenly see something is wrong. Meanwhile, using his common sense, and George had his wits about him, helped with his friend to put George onto the floor and recognized that George is unconscious and not responding. So what does he do? He starts CPR immediately. While within seconds, the people from across, the lifesavers from the swimming pool, come along with their package, and they've got one of these in their bag. They know what's going on as well. They start CPR, they put on the defibrillator, and they shock George. The AED says, shock. And they press the button, deliver a shock, and it says, continue CPR. So now the lifesavers who know how to do CPR are doing CPR. Meanwhile, because there were people around, the 000 call had gone out, ambulances were on their way. Within 3 minutes, 2 ambulances had arrived, and the first responder had arrived. And they took over the CPR. And every time they shocked, it said, shock. And after that, it said, continue CPR. By this time, 3 or 4 police cars arrived. So there was a lot of people around there now. George is still not responsive. Ambulances people came up, and they have a thing called the Lucas. If anyone knows what a Lucas is, put your hands up. Okay. So for those of you that don't know what Lucas is a device that they have invented which does CPR. Okay? So it's board placed under the back. It's got a part on the top, and that compresses the person that's unconscious. They call it the Lucas. Okay. So that Lucas took over and they did CPR. Meanwhile, the police were trying to coordinate which is the best way to which hospital. There are 2 choices, St. Vincent's or RPA hospital. And they figured that they'll save 4 minutes if they escorted the ambulance to St. Vincent's. St. Vincent's were waiting. By the time they got there, they found out there was a problem with the heart rhythm. They put a pacemaker, and today, George is back at work. After about 11 minutes of CPR. Okay? So that just tells you exactly what you heard earlier on. Every minute counts. Good quality CPR can save lives. And can you imagine how John would be feeling every time he sees his friend George back at work? So after all this, inshallah, you'll be empowered to do the same. Jazakallah.
As always, Jazakallah khair. Now I'll introduce you to the core of our program. Please welcome Dr. Farhad Khan. He's going to take you through the demonstrations, and after that we'll break out for actual practice, so not long.
Okay. Assalamu alaikum, everyone. So interestingly, we've got, move to the middle. Yeah. Interestingly, we've got people like anesthetists and paramedics here and senior doctors here. And they thought it was a good idea to get the intern to present this, but here I am. But I think that kind of highlights something, that you don't need to be an expert to be able to do effective CPR and help people, right? You can be someone who isn't medically trained, and you can help people in a way that can actually essentially save their life, okay? How do we change the slides, sorry? How are you pressing this? Thank you. Sorry. A refresher on the screen. Okay. So we're going to do 3 main things. We're going to have a look at videos to kind of show what the process is like. We're going to also get some people who have some really good experience to do some demonstrations. And then we're going to go do some practice where you get to have some hands-on experience doing all these important life-saving skills. So it's my absolute pleasure to be here today to go through 3 very important life-saving skills They're simple. You don't need to be an expert. And the three are called, the first one's called CPR, stands for something very long and fancy, cardiopulmonary resuscitation. Don't worry about that. So remember 3 letters, CPR. Then we've got a skill, how to put someone into what we call a recovery position. And then the final skill is what do we do when we see someone choking, if it's a kid, if it's a baby, or if it's an adult. Now, from left to right, CPR is for someone who is unconscious and not breathing or not breathing normally, okay? The recovery position is for someone who is unconscious, but they are breathing normally. And the final one is choking, which I'm sure everyone knows. It's when they have something in their airway and you can basically see them coughing up, or they might not be coughing at all and they might be grasping at their neck. So first skill is CPR. Like I said, unconscious but not breathing or not breathing normally. So this is something called the chain of survival. And the way I like to kind of think of this is that all these 4 things are absolutely vital, right? We need to kind of think of, as bystanders, we're thinking of the first 3. So early recognition, early CPR, early defibrillation. Early, 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 as soon as you can, right? And I like to think of this like as if you have a car and you've got 4 wheels. If any of the wheels are missing, what's going to have a helper here? Reem, what happens if one of the wheels are missing in a car?
The car does not work.
Perfect, right? Fantastic. So the car's not going to be working. So we need to be able to ensure that all the wheels are turning together and that we do all these things as soon as possible, early, 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 okay? So we're going to go through a video. It has a really nice, it's a really nice diagrammatic video, and it's going to tell us a little bit more about CPR. Oh, actually, before that, we're going to go through this other little acronym, a nice little thing to remember. Doctors A, B, C, D. And again, I'm not going to go into too much details because a lot of the videos do cover this, and the demonstrations will cover this as well. D is for danger. So when you see someone in a situation where you feel that they're not looking well, before you go to help them out, you want to make sure that you're not putting yourself in danger. So for example, if you see like a roadside accident, you don't want to just run in blindly and say, you know what, I want to go help that person. Although that's well-intentioned, you actually might hurt yourself. And as a result, no one's getting help. Now there's 2 people who need help. Now we need 8 wheels, right? So first things, look out for danger, make sure you're safe so you can help other people. The next thing is you want to look for a response, and we'll go through that in a demonstration. We want to send for help, so that includes getting someone nearby to maybe call the ambulance, or maybe you call the ambulance. You can also get people to bring a defibrillator, which we're going to go through. And there's other roles that we can do. For example, going to the front entrance and helping the ambulances come in and so on and so forth. Then you go through the airway. You make sure they're breathing normally. You start your CPR, and then you do something called defibrillation. But the videos are going to explain this quite well. So let's have a watch.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
Okay, so that's a really good video. So once you've checked for danger, you look for a response, you've sent for help, and you notice that they're not breathing normally, right? Or they're not breathing at all, you want to start this cycle. So I think there's some really important points that they mentioned in this video. I think the number one very confronting thing is that if you were to do this on a real person, you will probably feel that ribs are breaking under your hands. And that is because the ribs are actually breaking under your hands. And that might make you feel scared, or it might make you feel like you're doing the wrong thing, but that's actually what we kind of expect. And the paramedic sister was mentioning that a sign of good CPR is actually when you actually do break the ribs. It means you're going hard and you're going fast, okay? The next thing is, they mentioned you need to go deep enough and you need to go at the right speed. Now, sometimes when people listen to this, they say, how am I going to do 100 or 120 compressions? But the reality is when these situations arise, people have so much adrenaline and they feel so stressed that they actually go much quicker than they're supposed to. And that's because in your mind you're thinking, if I go quicker, that must mean I'm doing more effort and that's going to help the person. But we want to try and stick to about 2 compressions per second. Okay? And when we have practices, we'll see how that feels. And some of these defibrillator machines actually have a sound you can hear that shows you when you should be pressing so you can keep up with the sound. The next thing is early defibrillation. So there's going to be a video that kind of explains the point of it. It's a little bit complicated, but all you want to kind of get from this video is the fact that you need to put on pads. So one under the right collarbone and one just on the left side under your armpit. And you just follow the instructions. These are automatic or semi-automatic. So automatic ones will basically tell you the instructions. You put on the pads, it will figure out all the heart stuff. It will figure out when to shock. It will tell you when to let go. It will tell you when to start compressions again. Semi-automatic ones are the ones where it will tell you when to compress. It will tell you everything except for the shock. It will get you to press a big red button that delivers the shock, and it will instruct you to start again. Okay. So the next video might be a bit complicated, but just remember, the point we want to remember is put on the pads as soon as possible and then listen to the instructions.
Video is intended to help you understand how an AED works. The ECG strip you are going to see is from Steve's actual save, a real person who is alive today because of an AED and some good Samaritans who took action. Once you turn on an AED, the machine will begin to speak to you. Follow the voice prompts. Once the pads have been placed, the AED will instruct you to stand clear and to not touch the patient while it does an ECG of the heart. The AED is designed to determine if the heart is in a normal rhythm or if it needs to be shocked. In this case, the heart is in ventricular fibrillation, the most common rhythm when someone goes into sudden cardiac arrest. Notice how the heart is not beating effectively. It has electrical activity, but it is uncoordinated. The heart looks like it is shaking like a bowl of jelly. When in this rhythm, you can see the heart is not effectively pumping any blood out. This rhythm is deadly and has to be stopped. When the AED reads a shockable rhythm, the AED will either instruct you to press the shock button, or some AEDs are automatic and will automatically shock the person. At this point, no one should be touching the patient. The AED will send an electrical current through the heart and back again. The purpose of this shock is to stop the heart completely for a very short period of time from this uncoordinated rhythm and give it time to reset. Notice how the shock stopped all the electrical activity in Steve's heart for a brief period. Seconds after this shock, our own SA node, the pacemaker of our heart, will try to regain control of the heart and tell the rest of the heart when to squeeze. It can take up to 2 minutes for the heart to reorganize itself electrically after a shock, before it will function again and effectively pump blood to the brain. This is why you will be instructed to begin CPR immediately after the shock. Your job is to push hard and fast in the center of the chest in order to manually pump blood to the brain to keep the brain alive. Your compressions will not interfere with the heart trying to reorganize itself electrically, so do not worry about that. After 2 minutes, the AED will instruct you to stop CPR. It will reanalyze the heart and advise whether another shock is needed. Always listen to the machine and follow the voice prompts. In Steve's case, the ECG picked up a healthy rhythm and therefore a second shock was not advised. In Steve's case, only 1 shock was required to bring him back to life. Steve's heart continues to beat and he is alive and with us today.
Okay, so I guess before we get into some demonstration, I think a very important point to mention here, and I guess this is especially in our community where modesty is very important, and we oftentimes we're covering our whole body, we may be wearing multiple layers. It's very important, no matter who you're seeing and you're helping with CPR, doesn't matter if it's a man or a woman, you actually have to remove every single piece of clothing. That means the shirt, that means anything underneath, and that includes bras as well, okay? So I know typically people are trying to honor the modesty and we're trying to be respectful, but I think the most respect you can give to someone is actually saving their life, okay? So we need to be removing the clothes, including the bra, and it's very important because when you put on the AED pads, if they're not on the skin, the bare skin, then it's not going to be effective. You might as well be shocking the floor at that point, okay? So we need to be making sure we remove the bra, and when that happens, you may also have the breast falling to the side, so you may have to scoop them up and remove them from the left side, place the pad underneath, and then you can let the breast rest again, okay? And then continue with the CPR, as we kind of mentioned. Another thing that might be a bit confusing for people is they say, when I do CPR, do I just keep going and then if it doesn't work, do I put on a defibrillator? These things actually work at the same time, just like a car's wheels work or tires work. So your first priority is to immediately start CPR and get help from someone nearby to put on a defibrillator, right? So while you're doing your CPR, you'll get someone to actually put on the pads at the same time. You can move a little bit to the side to let them put it under the right collarbone. You can move to the other side to let them put it under the left area, and then you can listen to the AED for further instructions. So we're going to have CPR demonstrations at the end, and I think that's going to help bring this to life for everyone. And I think just before I move to the next section, the first tire that we saw was early recognition. So as Dr. Sahab, mentioned, the most common cause of a cardiac arrest is a heart attack, and some signs of that is shortness of breath and chest pain. So you want to call then before you even get to the point of CPR, inshallah. Next thing is the recovery position. So this is when someone is unconscious, but they are breathing, right? So I'll just let this video play and teach you this very important skill, and you'll go through it as well in this breakout stations.
If they're unconscious or unresponsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction, their tongue, from falling back and blocking the movement of air. It also means that any vomit or fluid which comes back up can come out, rather than causing them to choke, which could happen if they're on their back.
To put your casualty into the recovery position, this is what to do. Kneel beside the casualty and get yourself in a comfortable position. Check the casualty's pockets and remove any bulky items. Remove any sharp rings, and if they're wearing glasses, take them off. Make sure that both the casualty's legs are straight. Place their arm nearest to you out at a right angle to their body, with the elbow bent and the palm facing upwards. Their arm can be placed straight out to the side if it can't be placed at a right angle. Take their other arm and place it across their chest, and hold the back of their hand against their cheek nearest you. With your other hand, lift their far leg just above the knee. Pull it up until their foot is flat on the floor. Now you're ready to roll them onto their side. Keeping the casualty's hand pressed against their cheek, carefully pull on their bent knee to roll the casualty toward you onto their side. Now their top arm should be supporting their head, and their bent leg should be on the floor to stop them from rolling over. Their top leg should be at a right angle to their body. Remove your hand from under theirs. Check the casualty's head is tilted back. This will keep their airway open and clear.
Once the casualty is in the recovery position, you should call for medical assistance if this hasn't already been done. Remember to recheck the casualty's breathing at regular intervals until medical help arrives. If it stops, you'll need to give them CPR. If the casualty has to be kept in the recovery position for more than 30 minutes, turn them onto their opposite side to relieve the pressure on their lower arm, unless their injuries prevent this.
Okay, so that's just a bit of a summary on that, and you'll get to see that demonstrated to you live as well. The next thing is choking. So what do we do when someone's choking? There's a brilliant video that's going to cover this for us. So I'll let that video play.
Choking often results when a casualty inhales food or an object whilst running, laughing or crying. Choking prevents breathing and can be partial or complete. Partial choking allows some, although inadequate, flow of air into the lungs. If the airway is partially obstructed and the casualty can breathe, speak, cry or cough, the first aider should lean the casualty forward and encourage them to cough to remove the object. If the obstruction persists and the airway is not clearing, seek medical attention and instructions urgently. Prolonged or complete airway obstruction is potentially fatal. If the casualty is unable to breathe, speak, cry or cough, the airway is fully blocked. They may be clutching at their throat, have increasing blueness of the face, neck, ears and fingernails, and may become unconscious. Position the casualty leaning forward and initially give 3 or 4 sharp, firm back blows between the shoulder blades. If back blows are unsuccessful, the first aider should perform up to 5 chest thrusts. These are given in the same position as CPR. Check after each thrust to see if the obstruction has been cleared. If the chest thrusts are not successful, alternate 5 back blows with 5 chest thrusts and seek medical attention and instructions urgently. The choking infant or child is managed slightly differently. A child with partial airway obstruction should be allowed to cough and may be placed in a steep head-down position over the first aider's knee. If the child's airway is totally obstructed, back blows are delivered. Again, if back blows are unsuccessful, the first aider should perform up to 5 chest thrusts.
Okay, so that's for choking. Now, you can have a read of that. I guess one outdated thing that people might have learned, especially back in the days, was something called the Heimlich maneuver. So it's like, I'm not going to demonstrate. If you don't know it, it's good. Don't worry about it. It's basically where someone, goes behind a person and presses in and tries to get the airway clear. We don't do that anymore because that can cause other complications that just makes the whole situation worse. So here are some important things to do. Main things to remember is that if someone If someone can cough on their own, that's great. You let them cough and you just stand by them and see if they need any support, but you don't need to do any back blows or any chest thrusts. And once they are unable to cough, right, and they showed some signs, for example, grasping at their throat, that's when you want to start doing the back blows and chest thrusts. So important point is that this is not a full training course. You can get a full first aid course through organizations like St. John's Ambulance. I heard that they have 10 free course codes that they're going to give out, so you can actually get access to that for free to 10 lucky people. But besides, if you want full training, make sure you go out there and you find that full training. Sometimes your workplace can support that, so get in touch with your workplace and see if they can support your training, okay? And most importantly, above everything, we don't want to get to the point of doing CPR. We'd rather stay healthy in the first place, not do smoking, not do argile, eat healthy, daily exercise, and sleeping well. And again, if we've made any mistakes, if I've made any mistakes, please forgive me and forgive us. You all get a certificate, but it's not an official basic life support or CPR training certificate. And make sure that you share this on WhatsApp with your community, because if you learn this and then you pass on to someone else and they help someone, you'll get the reward for that. And for every person they tell in the future, you'll also get the reward for that from that. So make sure you do that, and inshallah we can be leaders in our community who are the first to respond, because in cardiac arrest situations, looking at data around the world, usually only 35 to 40% of people who get a cardiac arrest actually have someone helping. So about 60% of people actually have no one helping, right? So now that you know this, you can be the one to do that. Make sure you're confident, and remember that any attempt of doing CPR is better than not doing CPR at all, right? So even if you're unclear, oh, how much was it, 100, 120, I forgot, don't worry about it. Do something, because that something can only help them, okay? Thank you very much for listening. Jazakallah khair, and we'll go into some practice.
All right. I know everyone's very, very keen to go on practice. Before that, we'll get Brother Imran here to demonstrate how to do it. And once you get a hang of it, then you're free to practice as much as you wish.
So I'm going to talk about it and he's going to demonstrate it. Okay. All right, assalamu alaikum everybody. My name is Imran. I'm going to run you through our DRS ABCD again. Are we going to get it on the screen, Moin? ABC on the screen again. All right, we're going to go through the DRS ABC again. The reason is just to show the importance of it. Yeah? So whenever you come across a casualty on the ground, the first thing we're going to look out for is danger. When I say danger, danger to who? You have yourself as a first aider there, you have some bystanders around, and now we have a casualty on the ground. Can anybody tell me who will be the most important person here? The first aider. The first aider needs to take care of himself first. Why would the first aider want to take care of himself first? Because if you injure yourself, you have no help to anybody. The next group of people you're going to look out for would be bystanders, ensure their safety. Because we already have one casualty on the ground, we don't want any more. The next thing we're going to look out for is a response. At this stage, we don't know whether the casualty is unconscious, or they're just taking a nap. We know nothing about them. We're going to go for a voice response. We're not going to touch them because maybe they're taking a nap. What do you think is going to happen? They're going to punch you. Leave me alone. Yeah? So the first thing we will go for a voice response. Can you hear me? Open your eyes. What's your name? If not, I'll squeeze his hands and see if I get any reaction. Why would I want to squeeze his hands? Sometimes a casualty can't hear you, but they can feel you. You squeeze their hands, they squeeze back. Is it a good sign? Yeah, it's a good sign. At least we know they are conscious. If they don't respond, now we're going to go for a pain response. Here we'll squeeze their shoulders one at a time and see if we get any response. If you don't get any response, now we're going to send for help. When sending for help, always call the number 000. Try not to be in a habit of saying, can somebody call an ambulance? We don't know who who we're addressing it to. That person might have just landed yesterday from overseas. They don't know the number. Not that 911 is not going to work. 111, 9, all work. It just takes 20 seconds longer to get through. Our number is 000. Let's get in the habit of, when addressing, can somebody call 000? Yeah? The next thing we're going to go through is checking the airway.
Right, so we're going to just walk through quickly and have a look, and let's assume, as Brother Imran said, we've checked for danger, everything is fine, everything looks fine, but there's somebody that seems to be unconscious here. So I'm going to come and have a look here. Excuse me, can you hear me? Open your eyes. What's your name? Can you squeeze my hands? But no hands. Can you squeeze my hands? Hello, hello? There's no response. Brother, can you come please, quickly? Can you call 000 and tell me when you've come, when you've done that? What's your name, brother? Amen. Can you have a look and see there's an AED here or a defib and bring it and come quickly? Okay, so we've now done the DRS. We sent for help.
The next thing we're going to check is the airway. At this stage, we will not tilt the head back. Why? Because we have not looked into the mouth. Because if there is anything in the mouth and you tilt the head back, you've now created a highway straight to the lungs. So whatever's in the mouth could get into the lungs. So the first thing we call is called a pistol grip. Look in the mouth, see if the airway is clear. If the airway is clear, the next thing we're going to do is check for breathing. It's something we call look, listen, and feel. So one hand on your diaphragm. Yeah, one hand on the diaphragm, your ear over the nose, your cheek over the mouth, and you do this for 10 seconds. We don't want to do it for 5 seconds, and we don't want to do it for 15 seconds. We prefer just 10 seconds because it gives us enough time to make a decision. Is the casualty breathing or are they not breathing? Yep.
Yep, and we try to engage all our senses so you can feel the air on your cheek, you could hear them breathing, and you can also look at the chest rising and falling, plus your hand on the sternum area you can see if it's going up. What we're looking for here is proper raise and lowering of the chest. If they are breathing abnormally, that is not effective breathing, which means we're going to go straight away into CPR. We're going to start chest compressions. Okay, when we're doing chest compressions, try and get yourself in a very comfortable position. Does anyone know how long it'll take before you can get tired doing chest compressions? Depends on how fit you are, but it'll probably 2-3 minutes is the maximum. So it's important to have people around you who you can use and tag team, because you want to try and be on the chest as long as possible. Okay, so we'll try and demonstrate that to you and show you how we'll do a handover and how we manage that. Okay, so I'm going to start chest compressions, get myself in a comfortable position. I'm going to try and engage and use my big muscles, not just my hands, because that'll make me very tired. So I want to really lock my elbows, lean over. You may want to use that sort of a grip. Whatever is comfortable for you, but basically on the sternum area, and we are looking for about 1/3 of compressions. So that's what we're looking for. Okay, so I've already just done about 10, and I can already start feeling that I'm getting tired. Now, in the meantime, Brother Eamon should have come now with an AED and letting me know that he's called the ambulance. Ambulance has been called. Okay. Listen, Brother Eamon, I'm actually going to get tired. Close. I'm getting a little tired here. It's taken him a few minutes to get here, so now I'm going to hand over to him to continue chest compressions while I get to do the AED connected. Okay, Brother Eamon, can you see what I'm doing here? Because he may not be trained on doing any chest compressions, so I need to explain to him what I'm doing. Can you see what I'm doing here? I want you to put your hands exactly like this. Lean yourself right in front of me. And I'm going to count down from 4 to 1. And I need you to just continue doing these sort of breaths, and I want you to make sure you're going down about 1/3. Tell me when you're ready. Are you ready? Yes. Okay. On 4, 3, 2, 1, go. Now you see the time that I spent on handing it over to him is limited. There's very little time that we've off the chest. In the meantime, now I can get my breath back, and he's got the AED here. I can now plug that on. He does not stop while I'm putting the AED on.
Adult mode. Remove all clothing from patient's chest. Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin exactly
We're
as
just
shown
going to
in the
follow
pictures.
instructions from the AED.
Press pads firmly. Apply pads to bare skin exactly as shown in the Do not touch patients.
St. Clair, listen to the AED. Now that I've put the pads on, it's going to tell me what to do.
Everyone clear. Press flashing button.
Scan clear.
Shock delivered. Provide chest compressions to the beat. The heel of one hand should be in center of chest. The other hand should be on top of first hand.
The ASD has sensed that the casualty has not recovered, so it's asking us to continue.
Provide 2 breaths.
If it does say
1.
provide breaths, don't worry about that
2.
at this level. Just continue chest compression.
Resume chest compressions.
So Brother Eamon, are you
Push
tired? You
down
want me to take
hard
over?
at least 5 centimeters.
Give me the instructions when you're ready.
On 1, 3, 2, 1.
Provide 2 breaths. 1. 2. Resume chest compressions. Push down hard
The
at
sound
least
you're hearing,
5
the beep,
centimeters.
beep, beep, it's a guide to you to compressions.
Provide 2 breaths.
You can probably stop there, but that's
1.
effectively what you're going to need
2.
to do.
Resume chest compressions. Push down hard at least 5 centimeters.
Everyone clear on that? Okay. You know, just demonstrate and show what it looks like on an infant and on a... So if you've got somebody who is much smaller built, the only difference is you may want to not use 2 hands. On this instance, very much the same thing, but you could use 1 hand to do your chest compressions. Again, 1/3. Okay? And for a baby, so the baby is slightly different. So what we do is we don't do a head lift and a chin lift and a head thrust, because they've got a very soft windpipe. Right? So you want to make sure you put them down on a flat surface, support the head, and keep them. So your chest compressions actually occur on the sternum with using 2 fingers at exactly the same rate. And if that's not comfortable, you could actually use your 2 thumbs. Okay?
I can ask Moeen now.
The other thing is for an AED, for somebody who is very small, you could, as we showed, demonstrated here, the pads go on, one on the top right shoulder, the other one on the side. For an infant or a baby, one in front, one in the back. Okay? Okay. Now what we'll do is we might just demonstrate the recovery position. So Brother Eamon is lying down here. What's the condition? When do you put somebody in a recovery position? What are you looking for? Excellent. Unconscious and breathing. If they're unconscious and not breathing, what are we doing? Fantastic. So, yep. So I've got Brother Eamon here, who's now unconscious. I've checked his airways. He is breathing. Remember, we've already sent for help. Even if he's breathing, we're sending for help. Okay? Okay. So Brother Eamon, I can talk to him because he might be semi-conscious. He could hear what I'm saying. I'm going to explain to him what I'm doing. Okay, Brother Eamon, I'm going to put you in a recovery position. I'm just going to remove your glasses. Just check if there's anything in his pockets that might, as I showed, move that on the side. straighten his legs, put them together. Hand closest to you down at a right angle on the side. Okay. The other arm across the chest, palm facing up there. Leg that's furthest away, pull that up until it is parallel to the ground, and then just tilt him over. Move that leg down there so that locks him from actually falling over. We now move our hand away and open his airways. What is very, very important at this point now is this casualty is still unconscious. So you need to make sure you continuously check if he's breathing, his airways are open, because he could stop breathing. And if he stops breathing, what are we going to do? CPR. Put him back on his back and start CPR straight away. So you continuously monitor his breathing and make sure help is on the way. I think you deserve a prize. There we go. All right, any questions? So, right, so if he's not breathing and there's vomiters, remember when we said check the airways? So if you can do this quickly, turn him on his side to clear his mouth out. You may want to use his finger. Don't put your hand in his mouth. Might bite you. So be careful about that. He could be having a seizure, for example, and his mouth could actually lock up. So be careful about that. You could use his little pinky finger in the recovery position. Just clear it if you can. And if you can't, literally just start CPR. That's the most important thing. You will feel it. So when you start doing CPR on someone like this, you're going to probably feel the break straight away. Yeah. That means you've probably done, if you're doing an effective CPR, because that means you're going deep enough to ensure that the heart is getting compressed. Because remember, what you are doing is taking the place of his heart. Right? You're pumping blood around his body, oxygenated blood to his brain, and keeping his vital organs alive while help is coming. So you need to go deep enough to be able to squeeze blood out of his heart through the rest of the body. And so when you release it and you're bringing your hand up, it fills the heart again. So you're just basically pumping the heart. But to do that, you need to get quite deep, 1/3 down the chest. And that would result quite often in ribs breaking. And that's normal. Right. Excellent question. So if you look at the chest, between the nipples, there is a little section here on the top. So it's really the center of the chest. It's the sternum. That's where, effectively, if you look at your rib cage, you all feel that. When you get to the center here on the top, that's where your sternum ends. That is directly over where you're placing your arms, in the middle of the chest. Yes, sister? Excellent question. Most of the defibrillators are now becoming a lot more prevalent around in shopping centers. In fact, just 2 days ago, we had Woolworths in their trucks now having defibrillators put out. So it's becoming a lot more available in a lot more places. So you'll find that even masjids will have potentially a defibrillator. So always ask for one. If you've got one, access to one, put it on as quickly as possible. There was a question in the back there, sister. Sorry, I didn't hear that. Yes, you can. So usually pacemakers are on the top here. Just make sure you're a little distance away, and you may even be able to feel it, but there's no harm. You can still put the pads on. And you want to put the pads on. Why we put one up here and one down there is because that's in line with the heart. So you want the electrical activity from the one pad to the other to go through the heart. And usually pacemakers are not placed where you're putting the pad. Don't put the pad on the pacemaker if you can't feel it. Put it on the side. It's on the other side though. So you're putting your one pad on the left side in the bottom and one at the top. So you might have it down there on the right. So it should be quite far from where the pads are placed. Sorry? Yes? Okay. I think we should probably get some of the doctors to answer some of these questions. Dr. Patan?
No, we only carry on.
Yes, sir? A cold. If they got a cold, are they breathing? Would they be breathing if they have a cold? They're sneezing. So are they breathing? Are they conscious? When you have a cold, are you conscious? Can I talk to you and ask you if you are sneezing? Will you respond? Yes. So you don't do CPR on somebody who is responsive. All right. Good question.
Yeah.
Throw both.
Yep.
There you go. You have a question? Sorry. Right, so the question is, should you pause your CPR if you need to call the ambulance? Most phones have got speaker phones, right? Call 000, put it on speaker, leave it on the side, and do your compressions, chest compressions. The more time you have on the chest, the better. As we explained, every minute that goes past, you are reducing your chance of survival by 10%. So you want to make sure you're doing CPR early and you're doing it for as long as possible. There's a question here. Let's see who can answer this. We haven't covered it. There are 3 times when you should stop CPR. When? When is that? Children shock is the 4th one, but yeah. When should you stop CPR? Let's assume you don't have a defib and you are doing CPR. Excellent, that's 1. So they come back to life and they push you away. So you know they've come back, right? So you stop CPR. Don't fight them. What's the 2nd time? Excellent. Give the sister one as well. So if help arrives and the paramedics are there and they take over, so that's the 2nd time you stop. And when is the 3rd time? And this is the worst one. Don't want to get there, but sometimes it just happens. Yes, sister? That could be one, yes? Now. That could be a case, yeah? Now, actually, what we're looking for here is if you are alone and you physically just cannot go on anymore, right? There's no help around, there's nobody around, and this is like you've absolutely now your health is at risk, you just can't go on anymore. Obviously, then you can't do it anymore, right? So there's only 3 circumstances. If the patient comes around, either the machine will tell you or the person will push you around, tell you, look, stop, I'm okay. Help arrives, AED comes in, somebody else is there, you can hand over, just continue doing until that person either comes back to life or help arrives, or you absolutely cannot go on anymore. Yes. enough layers. Ribs break quite often, right? There's very low risk of having to pierce other organs and things. But what's important, because the ribs can heal. What can't happen is the person can't just spontaneously necessarily come to life without you helping them with circulations. Good question. Okay, so very good question. The question is about drowning. What do we do with somebody who has taken in some water, has left down? Follow your normal DRS ABCD. Make sure you don't put yourself in danger. If it's safe to get the patient out. Check the airways. They're unconscious, so there's no response, right? So remember our DRS ABCD. Follow that. Just keep to that. Danger to yourself, to that person, you managed to get them out. Let's say you safely got them out of the pool or wherever it is. So that's danger, sorted out. No response because they've probably inhaled a lot of water, right? So that's your response taken care of. Immediately send for help. So don't forget your basics. Danger, response, send for help. Check their airways. Is there water or fluid in the mouth? Maybe you can just put them in recovery and expel any excess fluid that's in their mouth. You open it and you check, there's not much, there's not a lot happening. You start, and then you check for breathing, obviously. Airways, breathing, right? They're not breathing 10 seconds, start CPR. That's all you can do. That's what you need to do, even for a drowning casualty. Yes, so thanks, doctor. So the other thing is when you're putting these pads onto the, for somebody who's drowning, for example, casualty, make sure the skin is dry. Just make sure so you take off all the clothing, and if you've got an AED that's available, just dry the skin before you put on the pads.
Usually when you buy an AED, it usually comes with a pair of scissors, a razor, a piece of towel, and a face shield. So you can use a towel. Even when somebody's suffering a heart attack, they will sweat. So you can use a towel to dry only the area where the pads are going on.
Okay. I think what we'll do is we're going to move on to the choking now. Because we want you all to spend some time and practice as much as possible. Okay, so in choking, you want to give the instructions.
Do you want to demonstrate?
Yeah, okay. Okay, so if somebody is choking.
Can you guys hear me? Yep.
Remove all clothing from patients.
So if you recognize someone who's choking, obviously you'd recognize the symptoms. They're having trouble with breathing, speaking. They might reach for their neck. So like the video showed, you would start off with 5 back blows, and you would have to go quite hard. You'd get them to support themselves possibly over like a table. And it would look something like this. So you strike them on their back between the shoulder blades and then check if the item's dislodged from their mouth. So you go 5 times. So 1, and check, 2, 3, and 4, 5. And if they're still struggling and nothing's been dislodged, then you would begin with 5 chest thrusts. So similar to CPR, but it would be a lot deeper and it would be a longer thrust. So you'd support them with one hand on the back or against the wall, and then with one hand at the front, and then 1, check for the airway, 2, check again, 3, and that would be 5. Obviously, you would have sent for help as well prior if you've recognized that they're struggling. They might be going blue in the lips or face, and you would keep going, and if they become unconscious and they're not breathing, then you would proceed with CPR.
Okay, so just repeat the question. So the question is, you've done all of this, you've checked, you've asked them to cough, you've done 5 chest back blows, the object hasn't dislodged, you've done the 5 chest thrusts, and you continue doing that maybe 4, 5, 6 times, and the person is now becoming blue, becoming more and more unconscious, then they fall to the ground, and they're lying. What do we do next?
So in that case, I would stick to the doctor's ABCD protocol, check for response. Can you open your eyes? Can you hear me? Can you squeeze my fingers? If there's still no response, you would check for breathing. For 10 seconds, look, listen, and feel. You would have sent for, if they're not breathing and they're unconscious, send for help, and then you would begin CPR.
Yeah. So I think in this particular case, what is happening is you've already sent for help. They are choking. You are busy treating this casualty, right? And now you can see in front of you, they have become unconscious. So you place them down on the ground. They're not breathing. You start CPR straight away.
Obviously check for airways as well within that protocol.
Yep. Hi. Swallows their tongue. What do we do if somebody swallows their tongue? So that's a myth. You can't swallow your tongue, but what can happen with the tongue is it can actually block your airways. So if you think of somebody who is, let's assume, in a car accident, right, and their head is slanted down like this, what happens is they can actually block the airways, or if they're on the back, and you can actually cause where the airway to block. So this is why we tilt the head back for an adult, and we open the chin to ensure that the airway remains open. That's not going to help at all. The issue, the question is, can you just throw water on somebody and get them up? If they're not breathing, no matter what else you do, it's not going to work. What's going to work is chest compressions.
I think that's it. Just in the interest of time, I think we'll just move out to the practical session to get some hands-on experience. And
Sounds
everyone,
good.
please make sure you have a go.
Okay, one last point here.
I would encourage every single one of you to actually have hands-on practice more than once on the adult, the toddler, and the little baby, and do all the things that you've been taught. Have as much experience as you can, because here's your opportunity. You don't want to be half-baked when the occasion arises. Now is the time to keep on doing it, changing between one and the other. Keep on doing it over and over again until you feel confident that if it does happen, hopefully not, but if it does happen, you are now familiar with what you need to do.
Thank you, Dr. Rashid, again. So this is the time to break off. So the boys is going to be in the front, the ladies at the back, and ladies who are seeking privacy, they can be behind the curtains. And as we are wrapping up, we will get certificates and there's food after that, if that helps.
Yeah, and
after a lot of exercise, some food. Over to you.
Yeah, alhamdulillah, there's also a lot of demonstrators around. Just look for the lanyards. So they will be walking around. If you have any questions, ask them. And you can't hurt the mannequin. So practice, practice, practice. They will tell you.
Assalamu alaikum, all the men to the front, all the ladies to the back. We're going to do training sessions for the ladies behind the partition, please. All demonstrators, get your mannequins, find 2 or 3 attendees, and we're going to start going through in order, starting with the recovery position. We need to coordinate because you're the head. You're the lead of the demonstrators. So I need you to bring your demonstrators.
I'll just pick anyone.
Sorry? All the demonstrators are around. That's what I'm saying. Yeah. Yeah. Not that heavy. Watch for them. So this is for you.
Me?
These guys need to